Our Dr. Mallika has served as a valuable source of information as we try to navigate the vaccine process. And today she answers more of your questions with Paula Eben.
And Dr. Mallika Marshall, let's get right to the first question. Carolyn writes, I have had Lyme disease and still have symptoms of Lyme when under stress. Is it safe to receive the COVID vaccine?
Yes, even if you still have chronic symptoms of Lyme disease, you can get vaccinated against COVID. But as always, talk to your physician about any concerns that you might have.
Now, neither Mary in Hull nor Kathy have been able to schedule their second dose of the COVID vaccine. They wonder how long they can wait between doses for it to still be effective.
You know, I'm hearing that with some frequency, and I imagine it is so incredibly frustrating to not be able to schedule that second dose. And yes, ideally, you want to get that second dose 3 to 4 weeks after getting the Pfizer or the Moderna vaccine. But I don't want you to worry, because the CDC says even if you have to wait up to 6 weeks for that second dose, you don't need to start the series all over again. And remember, you're probably enjoying a decent amount of protection just after that first dose. So don't worry too much.
And Leslie writes, like my father, I get pneumonia after vaccines, and I also have severe reactions to tree nuts and chocolate requiring an EpiPen. Should I get the COVID vaccine?
Yes, having a history of pneumonia or a history of severe allergies to food or medications really is not a contraindication to getting the COVID vaccine. If you have had serious reactions to vaccines in the past, then you just want to make sure that you talk to your doctor first.
Smart to ask the question, though. Another viewer asks, I am getting the vaccine next Tuesday, and then the next day I need to have some blood work done. Is that okay, a day after getting the vaccine?
Yes, you could even get blood work done that same day, but it's fine to go and get routine lab work right after you've been vaccinated.
And the last viewer question is, what restrictions do fully vaccinated individuals need to follow if they travel from Massachusetts? Is documentation available, maybe a card?
You know, that is a good question. When you get vaccinated, you will get a card that will have the vaccine that you received and the date that you received it. If you need 2 doses, both of those will be listed on the card. And you can carry that around with you, almost like a passport. I took a picture of it with my smartphone so that I would always have it with you, but you will have that documentation in case you do need to show it to someone.
I'm going to do that. I'm going to take a picture of it, and I'm going to frame it. I'm so excited when I finally do get that vaccine. All right, Dr. Mallika Marshall, thank you so much. And of course, Dr. Mallika offers her best advice. But as always, consult your personal physician before making any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways to reach her. Her email, drmallika@cbs.com, on Twitter, @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall.